We're starting right now. All right.
All right. Coming up, are you a breast cancer survivor who went through radiation? Up next, we're going to tell you about a free service that you may want to take advantage of this month. Well, a lot of cancer patients are frequently marked with small tattoos to make sure that there's accurate radiation treatment every time they go for a visit.
And during the month of October, a local laser practitioner is offering free radiation tattoo removal. And joining us this morning is Dr. Deborah Mangione and patient Lenny Lehman. Thanks for coming in, guys.
Thank you.
Fun.
So tell us about this, because Nicole and I are kind of amazed at this. I didn't realize that you have to get a tattoo to show the technician where you're going to have the radiation, correct?
Right.
Explain this to people.
Well, you know, first of all, you get the cancer diagnosis, your jaw drops, you know, you get through that, you go through the surgery, you recover from that, then you get the chemotherapy, and your hair falls out, and you wait for your hair to grow back, and all these are measures of you're getting better, you're getting through it. Radiation, you go every day for a number of weeks, and they mark you with tattoos so that you can be placed in the exact same place every time, so that they can hit the tumor with the radiation in exactly the same spot. So you get through that, and that's not invasive. It doesn't hurt. For me, there were no side effects of that. However, for the rest of your life, you have tattoos, and they're not real big, but like I said, you go through this whole thing, and then you're like, oh, I've got to look at that every day. Right. Does everyone see it? No. Do I see it? Yes. It's in a bathing suit. It's very clear. In a low top, you can see the couple of little kind of almost black dots that look like blemishes. Right. So they offered this free way to remove them. I had talked with my radiologist a number of years ago about it. She was like, yeah, you know, it's not that hard to remove them, but, you know, the thought of going back to a hospital and, you know, just sort of doing the whole thing over again. And here you're in this beautiful place, this meta spa. You're like, oh, yeah. I'm here to get my eyelashes longer. And they offer you this wonderful opportunity. So
and they're little. Deborah, you were saying they're little marks, but like you said, they're black, so they don't really look natural.
That's right. They don't look natural. Many people, they're not visible on, depending on the size of the person and whether or not it bothers anyone. You know, obviously their decision whether or not they want to have them removed. But when people are in remission and they've really had a nice long recovery, and they still have these marks, it's something that reminds them all the time of what they've gone through. And I think sometimes the women just want to leave it behind and say,
at some point,
finished with that, I'd like to move on.
So how do you remove them?
Well, it's a special laser that we use. And so we've done this in conjunction with Alma Lasers. We've partnered with them to be able to offer this as a free service to people this month. It's what's called a Q-switch laser. So what that means is it's giving multiple pulses, thousands of pulses within a second. And so it actually blasts the pigment. It's not just a regular laser treatment where you can do either intense pulse light or laser to get rid of pigment in the skin. It's actually to get rid of a tattoo, you want to blast that and shatter that pigment. And so we use what's called
blasting and shattering doesn't sound good. I'll just let you know, but it doesn't hurt, right?
It's just the pigment. And
it's like being hit with a rubber band.
Oh. Okay.
That's what it felt like.
I've had those little snaps before where but that's usually done on your face.
Right, but it's a little different is what I'm saying. This is actually more power, but it's delivered in so many little tiny shots it doesn't feel any different from just one individual pulse of laser.
And Lenny, the difference must be, like, you can see it on your face, like you said, you don't want to be reminded every day.
I don't. Yeah. You know, not at this point. I mean, at first it was like, okay, you know, it's all over. But then it was like, I just want this gone. Yeah. I mean, I'm not psychologically scarred by having had breast cancer, but I also don't need to be reminded, because I'm done. I'm over it.
Right. Did you have any other services while you were there? No, don't. You don't have to. The Medi Spa, you don't have to tell us.
Well, look at my eyelashes.
Your eyelashes, they look beautiful. Very good.
But in honor of Breast Cancer Awareness Month this month, we are offering this as a complimentary service to any woman who has recovered from breast cancer to be able to come in and have this removed. And usually it may take 1, 2, even 3 treatments. I don't think it's going to take more than that because they are small dots and they are dark enough that the laser should be able to really attack it and be attracted to it right away.
And you're located in Pewaukee?
We are in Pewaukee, right off Capitol Drive.
And they just give you a call if they're a survivor watching out there.
That's right. And we also have an open house tomorrow night for any of these people who may be interested in learning more about our services.
Okay, great. And we've got the links on realmilwaukeenow.com too. So
great.
Very neat.
Thank you, ladies.
Thanks for being here, ladies.
Sure. Thank you, Doctor.
All right. No Halloween, no Thanksgiving. What? We'll tell you about a principal that's trying to put an end to celebrating all fall holidays. That's coming up.